Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Ophthalmic and Otic medications. A client went to a healthcare facility to ask instructions regarding on how to administer ophthalmic medications. The nurse correctly instructs the client to: Option A. Gently allow the tip of the optic bottle to touch with the conjunctival sac. Option B. Apply gentle pressure with a clean tissue to the nasolacrimal duct for 30 seconds after the administration. Option C. Blink quickly to stimulate tearing after the administration. Option D. Blow the nose to stimulate faster absorption. Right answer is Option B. Apply gentle pressure with a clean tissue to the nasolacrimal duct for 30 seconds after the administration. Occluding the nasolacrimal duct with a tissue over the inner canthus for 30 to 60 seconds will minimize the systemic absorption of the medication. Option A. Allowing the tip to be touched with the conjunctival sac will contaminate the medication. Option C. Will prevent the maximum absorption of the medication. Option D is not related to the administration of the optic drops. The client is receiving an eye ointment and an eye drop. The nurse instructs the client to: Option A. Administer the eye ointment first, followed by the eye drop. Option B. Administer the eye drop first, followed by the eye ointment. Option C. Administer the eye ointment, wait for 5 minutes then administer the eye drop. Option D. Administer the eye drop, wait for 10 minutes then administer the eye ointment. Right answer is Option B. Administer the eye drop first, followed by the eye ointment. If both an eye drop and eye ointment are scheduled at the same time, administer the eye drop first, separate the installation by 3 to 5 minutes. The nurse is preparing to administer Cyclopentolate, Cyclogyl, who will undergo a corneal surgery. The nurse administers the medication, knowing that the purpose of this eye drop is to: Option A. Dilate the pupil of the operative eye. Option B. Constrict the pupil of the operative eye. Option C. Reduces the intraocular pressure. Option D. Lubricate the operative eye. Right answer is Option A. Dilate the pupil of the operative eye. Cyclopentolate is a mydriatic and cycloplegic medication that works by temporarily widening, dilating, the pupil of the eye and relaxing the muscles of the eye. A client with glaucoma is receiving Betaxolol hydrochloride, Betoptic, eye drops. Which of the following interventions will the nurse likely do before the administration? Option A. Assessing orientation. Option B. Assessing peripheral pulses. Option C. Monitor blood sugar level. Option D. Monitor pulse rate. Right answer is Option D. Monitor pulse rate. Betaxolol hydrochloride is a beta-adrenergic blocker eye medication. The nurse should monitor the blood pressure and pulse rate for signs of hypotension and bradycardia. A miotic medication has been given to a patient with glaucoma. The nurse tells the client that the purpose of this medication is to: Option A. It blocks the responses that are sent to the eye muscles. Option B. It will relax the eye muscles and decrease blurring of vision. Option C. It will constrict the eye to reduce intraocular pressure. Option D. It will dilate the eye to reduce intraocular pressure. Right answer is Option C. It will constrict the eye to reduce intraocular pressure. Miotics causes pupillary constrictions and are used to treat glaucoma. These medications reduce eye pressure by increasing the drainage of intraocular fluid through the trabecular meshwork. Options A, B, and D are related to mydriatic medications. A client went to a healthcare facility with a complaint of difficulty opening the eyelid because of pain. The physician diagnosed the client with keratitis and is prescribed with an eye lubricant. Which of the following medicine should the nurse expect to administer? Option A. Hydroxypropyl methylcellulose, Lacryl. Option B. Pilocarpine hydrochloride, isoptocarpine. Option C. Timolol maleate, Timoptic. Option D. Aproclonidine, Lopidine. Right answer is option A. Hydroxypropylmethylcellulose, Lacryl. Hydroxypropylmethylcellulose, Lacryl, is an eye lubricant. Option B is a miotic. Option C is a beta-adrenergic blocking eye medication. Option D is a alpha-adrenergic agonist. The nurse is monitoring a client with glaucoma. Which of the following drugs, if prescribed for the client, would the nurse question? Option A. Metoprolol, optoprolol. Option B. Brimonidine, Elfagan P. Option C. Dorzolamide, Trusopt. Option D. Atropine, isoptoatropine. Right answer is option D. Atropine, isoptoatropine. Atropine, isoptoatropine, is a mydriatic and is contraindicated with glaucoma because of the risk of increased ocular pressure. Options A, B, and C are used to treat glaucoma. The nurse prepares an adult client for an ear irrigation as ordered by the physician. Which of the following procedure correctly performed by the nurse? Option A. Position the client with the affected side up after the irrigation. Option B. Pull the pinner down and back. Option C. Warm the irrigating solution to 98 degrees Fahrenheit. Option D. Directs a slow steady current of irrigating solution into the eardrum. Right answer is option C. Warm the irrigating solution to 98 degrees Fahrenheit. Warm the irrigating solution to 98 degrees Fahrenheit because a solution temperature that is not close to the client's body temperature will cause ear injury, vertigo, and nausea. Option A is not correct because the client is to lie on the affected side to complete draining the irrigating solution. Option B is applied only to children 3 years younger. Option D will cause a damage to the eardrum. The nurse is reviewing the drug list of an elderly client who is taking a lot of medications given by different healthcare provider. The client reports that lately, there has been roaring in my ears. Which medication would the nurse determine could be responsible for the client's complaint? Option A. Amoxicillin, Amoxil. Option B. Carvedilol, Coreg. Option C. Atropine sulfate, isoptoatropine. Option D. Aspirin, Ecotrin. Right answer is option D. Aspirin, Ecotrin. Aspirin, Ecotrin, is potentially ototoxic. The prescribing physician should be notified that the condition and the prescribed drug can be evaluated. Options A, B, and C are not associated with hearing problems. A nurse is providing instructions to a client with an impacted cerumen who is prescribed with carbamide peroxide, D-brox. Which of the following teachings made by the nurse indicates the further research? Option A. Do not touch the dropper tip or let it touch your ear or any other surface. Option B. Lie on your side or tilt the affected ear upward. Hold the dropper directly over the ear and place 5 to 10 drops into the ear canal. Option C. Hold the earlobe up and back. Option D. Use a cold preparation of the medication. Right answer is option D. Use a cold preparation of the medication. Carbamide peroxide is a cerumenolytic medication. Using cold ear drops can cause dizziness. In order to avoid it, hold the container in your hand for a few minutes to warm it. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.